Hello, my name is Maria Jose Hamel, and I'm here today to talk to you about how to treat a respiratory infection at home when you can't go to the hospital. And the reason why I'm doing this is because right now we're living in this global epidemic of a coronavirus infection. And I hope you were able to watch the last video I posted on the 8 steps you can take to boost your immune system. So that is something that can help you to hopefully prevent an infection, because your immune system is what keeps you healthy from all types of infectious diseases. Now, what I want to talk to you today is what happens when you do become infected and you have maybe a mild to moderate infection. And we know that because of the severity of the coronavirus pandemic, that it might be the case that at some point even our healthcare system will become overwhelmed. And they're telling right now people who have a mild infection to not even come to the hospital, because we're basically taking the place of other people who can actually need the treatment much more than we do. So if we have a mild to maybe moderate infection, they're telling people to try to stay at home and drink a lot of water and do things like that to get better on your own. So I'm going to tell you some of the things that can help you to alleviate some of the symptoms and maybe even boost your immune system in a way to help you recover quicker from an infectious disease. And it doesn't have to be necessarily a coronavirus infection. It could be a flu infection. It could be a cold. So any type of respiratory infection. So first, let me start off showing you this chart that shows you the most common symptoms for the coronavirus infection. The 2 most common symptoms are fever and a dry cough. So those tend to be mild. We know that 80% of the people who get the infection will have only mild symptoms, and those are the 2 most common. There could be some sore throat or some headache, but the most serious symptom is shortness of breath. So I just want to make clear that if you do have shortness of breath, to seek immediate medical attention, because that can become even a worse condition, such as pneumonia, and that could be quite severe. So seek medical attention if you do have shortness of breath. If you have the other symptoms and no shortness of breath and your symptoms are mild, you might need to stay home, because we've seen the pictures coming out of China and then afterwards coming out of Italy and maybe even other parts of the world will be facing similar situations of being overwhelmed with the amount of patients that are going to need medical care. So I want to go over some of the traditional treatments that were used in the past quite successfully when there was a respiratory infection. But I want to make clear that none of the things I will share with you are quote-unquote cures. There's a lot of misinformation on social media, the internet, and YouTube about so-called cures for the coronavirus. And the truth is, we don't know of any cures because this is a novel virus, meaning new, and there hasn't been enough research done. And by research, I mean that we actually compare a treatment with a placebo to make sure it is more effective than placebo. So that would require a randomized, maybe double-blind, placebo-controlled trial, the very highest quality of research to really make sure that the treatment we're giving is effective. So some of the things you hear on the internet, this will kill the virus, this will cure the virus. Make sure that you keep in mind that nothing has been proven to do that just yet. The things that I will share with you, though, have been proven in the past to help in cases of respiratory infection. And in the past, I mean way before we had vaccines and way before we had antiviral medications or antibiotics. But what I'm talking about right now is hydrotherapy, what we call traditional hydrotherapy. So this does not require to go into a pool. It's a different kind of hydrotherapy. The kind of hydrotherapy I will talk to you about is involves the use of hot and moist Fermentations, and they're applied to a part of the body, maybe where it could be used for muscle pain, for instance, or it could be used on the chest for someone who has respiratory infection. And I want to show you some research that talks about how moist heat does stimulate the lymphatic circulation, and the lymphatic system is part of your immune system. So for instance, this research article talks exactly about that, how thermal therapy using especially moist heat actually does stimulate the lymphatic circulation. This one talks about changes of temperature and how it stimulates lymphatic contraction and lymph transport. So lymph, being that fluid of the lymphatic system, is part of our immune system, and if that actually is stimulated to circulate better, it will help our immunity. And this other one talks about hyperthermia, which is another word for heat, and how it stimulates human leukocytes, which are also part of our immune system, to function better. So there are some, at least, bases to say that hydrotherapy can help the immune system fight an infection. And again, like I said, it was used in the past, way back in the 1918 pandemic of influenza, the Spanish influenza pandemic. It was used quite successfully. So I'm going to talk to you about what is traditional hydrotherapy and how you can use it at home. So again, traditional hydrotherapy involves the use of what I call fermentations. And for this, you would need a cloth, which ideally you can find a fermentation pad that would be made out of about 50% cotton, 50% wool to retain heat and moisture better. But towels work just as well. So you can use towels, or you can use terry cloth or some other type of rag for this. And you would get it wet, and you would get it heated. And I'll show you the 3 most common ways to heat them up. But after this towel is wet and hot, you would wrap it in a dry towel, and then that is your fermentation. That's what you're going to use as a fermentation. And so I'll tell you the 3 most common ways to heat them up. And the first one is to heat the fermentations by steaming them. So you would have a big basin or a canner where you put the rolled up towels. Once you wet them first, you put them in the canner or basin or big pot with a rack under the towels with water underneath. So you would steam them for about 20 minutes, and that should be enough time to get them very hot. And then you would remove one by one, and you would put them in the dry towel to use as a fermentation. The other way to do this is to use a microwave. So what you can do is wet the towel and wring it, then put it inside of a plastic bag that is hopefully a thick plastic bag, like a trash bag. And then you put that in the microwave for about 5 minutes. And after 5 minutes, you remove it very carefully not to burn your hands, and put the hot towel over a dry towel. And again, wrap it. And that is your fermentation. And the third way to heat it would be to actually use boiling water. So you would twist the towel into a long strip, and then hold the ends and form a U shape, and then lower that into the water and soak it in very hot water, boiling water. And then as you lift it up, you pull the ends to wring it. And again, you would put it on a dry towel and wrap it, and that's your fermentation. So any of those 3 ways to heat it work really well. But the important thing is to put the hot towel inside of another dry towel and cover it up, and then you put it over the chest of a person with a respiratory infection, making sure the rest of the body is covered. So you want to maybe ask them to undress. So you put the fermentation over the top of their chest. And if it's too hot, you might need to put yet another layer in between, so another dry towel. And then you leave that for 3 whole minutes. You want to time it. 3 minutes with heat, making sure the person is nice and covered. And then when the 3 minutes are up, you take out the hot fermentation, and then you get maybe a washcloth, and soak it in ice cold water and wring it, and then you gently rub the chest. Now, if that's uncomfortable, if there's some skin lesions, just put the cold towel over the chest. But if you can rub it, it's a little bit better. It actually stimulates circulation a little bit better and maybe get a little bit of redness in the skin. That's kind of what you want to achieve. And so you do that for 30 to 60 seconds. So hot for 3 minutes, cold for 30 to 60 seconds. And you repeat that 3 times. And that would be a fomentation to the chest. And that's very good for respiratory infections. Now, there's an even more complete treatment you can do in case of an infection, which would actually cause the temperature of the person to rise a little bit. In other words, it's called a fever treatment. And for that, you would use the whole full fomentation you see on the screen, which also includes a fomentation to the back. And that one is not changed throughout the treatment, is just left there. But since it's wet, you want to cover the bed with some kind of plastic and then cover that with a blanket or a towel and then put the hot fomentation and the person lays on top of it. And then you apply the hot fomentation to the chest just like before, and you put the feet in hot water. And again, this is to raise the temperature of the person. So you put the feet in a plastic basin with water at about 105 degrees. This will feel very hot at first, so you might want to start with a lower temperature and maybe add a little bit of hot water as you go, but make sure you don't pour the water on the skin. It has to be on the water itself so the person's not burned. And you want to keep that at about 105 the whole time. If you don't want to do a hot foot bath, what you can do is use an old style hot water bottle. Put it under the feet and then wrap the feet with a towel so that they stay very nice and hot. And then to keep the person from sweating too much, you use cold compresses to the forehead and the eyes and the neck area. And you still change the hot fomentation to the chest 3 times, alternating with a cold rub. So you do the exact same thing, but you do, as you see in the illustration, putting a fomentation in the back, the hot foot bath, and then covering the person. Make sure the person is completely covered with a sheet or towel so there's no drafts, there's no chills. At the end of this treatment, what you do is that when you remove the feet, you want to pour cold water over the feet and then dry them really well. And then to cool the person down, you would do a cold rub each part of the body at a time, only uncovering one part of the body at a time and rubbing it with cold water. And so you do the arms, the chest, the back, and the legs. And then you dry the person completely. You make sure you put on some warm clothing and they stay in bed for 30 minutes. So whether you do just the chest or you do the whole fomentation, it's very important that they stay in bed for the next 30 minutes for the treatment to really be effective. And I just want to let you know that this kind of treatment, again, was used quite effectively in the past. And here is an article that actually says that in the 1918 epidemic of influenza, it was actually much more preferred for children to do this for fever than to use aspirin. And aspirin at the time was being used for adults, but it was having a lot of negative effects because they were given very high doses of aspirin, so it was having some toxic effects in people. But luckily for children, hydrotherapy was the preferred treatment for fever as opposed to aspirin. And so one thing I want to let you know, though, is that you do not want to use this kind of treatment for someone who has lost skin sensation, either due to unconsciousness, paralysis, or on the feet of someone who has diabetes. So don't do a hot foot bath with someone who has type 2 diabetes because they might have neuropathy or any type of diabetes. Avoid using in those with leg or feet edema, varicose veins, advanced vascular disease, malignancy, tendency to hemorrhage, and stomach or bowel ulcers. But if a person has a respiratory infection and doesn't have any of the things I just mentioned, this could be quite effective. But you want to make sure that they are not exposed to cold or chilled air. So no drafts or anything like that, and hopefully the temperature of the room would be 72 degrees the whole time. And you can apply this once or twice a day during the duration of the illness, and they should feel better. Now, as you see, this might require help of another person, so you really can't do this by yourself. You need someone to help you out. What if you don't have someone to help you out? Well, maybe you can do the other alternative, which is contrast showers, which you can do by yourself. So it's not maybe as effective as the full fomentation, but it's still effective enough that it can help you. So what you do is that you go in the shower and you stay in the hot water for 3 minutes, letting that water, fall on your chest for about 3 minutes. And then after 3 minutes, you change to cold water, as cold as you can, take it, and then let that fall on your chest for 30 to 60 seconds, and then go back to hot water without burning yourself, but as hot as possible without burning, another 3 minutes or so. So you repeat that cycle again 3 times, the 3 minutes hot, 1 minute cold or so, 30 to 60 seconds cold, and it will have a similar effect. And then you can dry yourself and put warm clothing and stay in bed for the next 30 minutes. So that way this treatment will be more effective. So it should help you, because in the 1918 influenza pandemic, it was used in a seminary, a Seventh-day Adventist seminary in Hutchinson, Minnesota. And it helped all of those who were infected with this disease for the fever to come down in about 1 day. So just using this in a very careful diet and bed rest, they got better in about a day, and they had no serious cases of influenza in the Hutchinson Seminary. So it was used in the past quite successfully. Now, the other thing I want to tell you is that if you have respiratory symptoms and a dry cough, a steam inhalation can be quite helpful, especially to alleviate congestion if there's sinus congestion, and to alleviate a dry cough. So basically what you do is that you get a pod with hot water, and then you allow some of the steam to go into your nasal passages and into your throat. Now, you maybe want to use a towel to make sure more of the steam goes into your face, but don't cover yourself completely. And the other thing that's very important with steam inhalation is to do not get burnt by the steam. You have to be careful. But the other thing I wanted to talk to you about today is open air therapy. So let me just mention to you that back in the 1918 influenza pandemic, in the Boston, Massachusetts area especially, well, first of all, they had to set up these tent hospitals because they probably ran out of space in the regular hospitals. So they set up these tents, and some of the people were outside of the tents. And it just so happens that the people who were outside got better quicker than those who were inside of hospitals. And then in 2009, we have this article from the American Journal of Public Health that actually talks about exactly that. And it talks about how in the 1918 influenza pandemic, overcrowding actually increased the risk for flu tenfold, and the risk for flu complications such as pneumonia fivefold. So something about overcrowding was really bad. Then actually this article was printed at the time in 1918, and under the title Weapons Against Influenza, it's talking about that, again, open air treatment. And it was found by the Massachusetts State Health Department to be the most valuable factor in reducing mortality. And apparently it says the mortality of hospital cases was reduced from 40% to 13% by the treatment. An invaluable incident to this treatment is the fact that in the open air, the immunity of nurses and physicians is enormously increased, leaving them to carry out the great amount of work confronting them. In other words, the open air treatment was not only helpful for the patients to recover faster, but it also helped the nurses and physicians to become to be immune to be infected by this disease, so they can actually carry out their work. Now, there was another article printed in the same journal many years later talking about the exact same thing, and it's talking about how the conventional view is that little could have been done to prevent the H1N1 virus from spreading or to treat others or to treat those infected. However, there is evidence to the contrary. Records from an open-air hospital in Boston, Massachusetts suggest that some patients and staff were spared the worst of the outbreak. A combination of fresh air, sunlight, scrupulous standards of hygiene, and reusable face masks appears to have substantially reduced death among some patients and infections among medical staff. Now, let me just tell you that this has been discussed further, for instance, in the Journal of Hospital Infections, and talking about how open-air treatment was actually the preferred therapy for other infectious diseases such as tuberculosis. And down here it says that abundant fresh air together with sunshine acts antiseptically upon both the bodies and the clothing of patients, destroying all organic impurities which may emanate from either, and so purifying the air that enters the respiratory organs. Now, this type of therapy unfortunately was abandoned in the 1950s because we had antibiotics and other medications. And it says right here, the belief in the therapeutic and germicidal properties of outdoor air diminished. But in the 1960s, they actually did studies, and they found that the outdoor air was much more lethal to airborne pathogens than indoor air, both during the day and the night. And they used the term open air factor to describe the germicidal constituent in outdoor air that reduces the survival of and infectivity of pathogens. They didn't know what to call it, so they called it the open air factor. And I told you in the last video that sunlight actually has an effect of inactivating the influenza virus. And the half-life of the influenza virus goes from 31.6 minutes down to 2.4 minutes in sunlight. And this other article I also showed you as well, and it talks about how sunlight boosts resistance to infection and other older studies suggesting potential roles for surface decontamination. And it is too bad that modern practice for designing healthcare buildings is rather geared towards comfort, and it favors pathogen transmission. So the whole point of all of this that I just told you is to let you know that if you do get sick, do not stay in your room with your windows closed the whole time for days and days and days, because that is not good for you. It actually is better if you open the windows, let the sunlight come in, especially let the fresh air come in. It actually has germicidal properties. It has antiseptic properties. So as much as you can, get some fresh air and some sunlight, and that was the therapy used in 1918 quite effectively. Another therapy used quite effectively in 1918. What about some foods you can use? There are some foods that have antiviral properties. I'm going to start off with telling you about garlic and onion. Garlic and onion have been found to have antiviral properties, and in fact they have compounds, organosulfur compounds like quercetin and allicin, that are associated with inhibition of viral infection. Quercetin can affect entry and attachment of enterovirus and influenza virus on host cells. We don't know for sure about coronavirus, but onion and garlic are just foods, and it's not going to have any side effects, so it's worth trying. Another one that's known to have antiviral properties is ginger, and fresh ginger has been shown to have antiviral activity against respiratory syncytial virus and human respiratory tract cell lines. And it also has been found to inhibit the growth of influenza virus. So again, it's a food, it's not going to have side effects. We don't know if it works with coronavirus, but it can only help at this point. Another thing that has been shown in the past, and it's actually now been tried with coronavirus, is vitamin C. We again don't have those randomized, double-blind, placebo-controlled trials to know for sure if vitamin C is helpful, but here is an article talking about vitamin C and respiratory infections. And it says that 3 control studies recorded a reduction of at least 80% in the incidence of pneumonia in a vitamin C group, and 1 randomized trial reported substantial treatment benefit from vitamin C in an elderly population in the UK. People that were hospitalized with pneumonia or bronchitis. So we know it has good antiviral properties, and we know it could help people with respiratory infections. Now, when it comes to vitamin C, I always prefer to get it from food rather than from supplements, and in fact that's the case with most nutrients. And unfortunately with supplements, The problem with supplements today is that the supplement industry is very much unregulated. And so with vitamins, you'll probably be okay, but with other supplements, we don't know the purity, we don't know if it has indeed what it says on the label. And when they have done the studies, investigative studies, they have found that in up to 90% of the cases, the supplements do not contain what they say they contain. Sometimes they're altered, sometimes they just have less of the active ingredient, etc. So if you can get your nutrients from food, all the better. Plus also you get other nutrients that act synergistically. So you get, more vitamins, minerals, and antioxidants that I think are very helpful. So with vitamin C, you probably know citrus fruits contain quite a bit of vitamin C, but there's also other fruits and vegetables that have it, like kiwi, strawberries, broccoli, and peppers. Zinc is another nutrient known to help the immune system, and you can get it from a supplement, but you can also get it from these foods like almonds, sunflower seeds, pumpkin seeds, lentils, tofu. In general, legumes and nuts and seeds have zinc. Cysteine is part of another supplement called NAC. That one is increasing in popularity right now, but basically cysteine is an amino acid and it's present in a lot of foods. And these are the foods that I recommend that are plant-based that have cysteine, such as sunflower seeds, legumes, and lentils in particular. Even oatmeal has cysteine. Vitamin D, again, has been shown to help the immune system. And of course, best way to get it is through sunlight. There's some mushrooms that have it, but they have to be grown in a special way to actually have it. But if you don't have access to sunlight, especially in the winter in the northern latitudes, you can definitely get it through using a vitamin D3 supplement. And of course, vitamin B12 is very important. If you follow a whole food plant-based diet, you can get it through a supplement very easily. There's some foods that are fortified, such as nutritional yeast or some plant-based milks, etc. Now, to end this video, I want to give you my favorite remedy for flu and cold. So I'll give you a recipe today on, this is just a remedy that I use for my family, and it's just been used very successfully, almost works every time with colds and flus. So it has ingredients that I already told you about that have good proven antiviral properties. So it has onion and it has garlic, it has lemon juice. The other thing it has is honey, and honey has been proven to have some effects in coughs. So especially in children, it has been shown to be quite successful in suppressing a cough. And this article from the Cochrane collaboration actually is a review, and it shows that basically honey is better than not using anything at all. It's also better than using a placebo. And it's about just as effective as the most common ingredient in over-the-counter cough remedies. So you can use it also to kind of soothe the throat and help a cough. Now, if you are a vegan and you don't want to use honey, that's perfectly understandable. You can leave it out, maybe use some maple syrup instead. It won't have maybe the medicinal properties of honey, but it will at least help with the taste. But if you're okay with using honey, I recommend you get raw honey and local if possible, because nowadays, unfortunately, some of the honey in the market is not 100% pure. Sometimes it has been mixed with some cheap syrups. So I would recommend that you look for a product that is more reliable, like a local supplier that you know is reputable. So here's the recipe for this cold remedy. First ingredient is onion. I use about 1/4 of a big onion, which works out to be about 1/2 cup of chopped onion. I use about 4 to 5 garlic cloves. I use the juice of 4 big lemons, and that works out to be about 1/2 cup or so. So if you have smaller lemons, maybe 5 lemons. And then I put 2 to 3 tablespoons of raw honey. And the last thing I add is optionally a small piece of ginger, thumb-sized piece of ginger, which has been shown to not only have antiviral properties but also help with pain. So if you have a headache or a body ache, this could be really helpful. So you basically blend all of that and you keep it in an airtight container, such as a mason jar, refrigerated, and you take about 2 tablespoons every 2 hours or so until it's all gone. And if you want to make more, you basically just make more until you feel better. And again, this is all food. It won't have like side effects or anything like that because it's food. Some people ask me, can I take it just for prevention? And I'm like, sure. It's kind of like a dressing for that, right? It's like lemon juice with onion and garlic and ginger and honey. So if you want to use it, go ahead and use it. It's basically just food, but it could be quite helpful for someone who is going through a respiratory infection. So I hope this information has been helpful to you. In case you do get some type of respiratory infection, and use this information and share it with others. Other people might be going through the same thing, so share it with other people so they know what to do to stay well while they're taking care of themselves at home. And this could be just very beneficial to a lot of people. So please share it, and I hope to see you next time in the next video. Thank you for watching.